Hello and welcome. Today we're diving into the fascinating and sometimes painful world of nephrolithiasis, more commonly known as kidney stones. We'll explore what they are, why they form, and what can be done about them. So, what causes these pesky stones? The etiology of nephrolithiasis is often multifactorial. Factors contributing to kidney stone formation include dehydration, dietary imbalances such as high intake of sodium, animal protein, and oxalate, rich foods, obesity. Certain medical conditions like hyperparathyroidism and renal tubular acidosis, and a family history of kidney stones. Certain medications and supplements can also increase the risk. Let's talk about how these stones actually develop. The pathophysiology of nephrolithiasis involves the supersaturation of certain minerals, like calcium oxalate, in the urine. This leads to crystal formation. These tiny crystals aggregate and grow over time. If the crystals become large enough, they can obstruct the urinary tract, causing pain and other complications. Inhibitors of crystallization, normally present in the urine, may be deficient, further promoting stone formation. Kidney stones are a fairly common health issue. Epidemiologically, nephrolithiasis affects approximately 1 in 10 people worldwide at some point in their lives. Men are more likely to develop kidney stones than women. The prevalence of kidney stones has been increasing in recent decades, possibly due to changes in diet and lifestyle. The signs and symptoms of kidney stones can vary depending on the size and location of the stone. The most common symptom is severe, fluctuating pain in the side and back, often radiating to the lower abdomen and groin. This is often referred to as renal colic. Other symptoms may include blood in the urine, nausea, vomiting, frequent urination, painful urination, and fever or chills if an infection is present. Diagnosing kidney stones typically involves a combination of medical history, physical examination, and imaging studies. A urine analysis can detect blood and crystals. A non-contrast CT scan is the gold standard for detecting kidney stones, as it can accurately identify the size and location of the stone. An ultrasound may also be used, especially in pregnant women or children. An intravenous pyelogram or IVP is another imaging technique that can visualize the urinary tract. Kidney stones can be classified based on their composition. The most common type is calcium oxalate stones, followed by calcium phosphate stones. Struvite stones, also known as infection stones, are associated with urinary tract infections. Uric acid stones are more common in people with gout or those taking certain medications. Cystine stones are rare and occur in individuals with cystinuria, a genetic disorder. Treatment and management depend on the size, location, and composition of the stone, as well as the severity of symptoms. Small stones may pass on their own with increased fluid intake and pain medication. Alpha blockers can help relax the ureter and facilitate stone passage. Larger stones may require more invasive procedures, such as extracorporeal shockwave lithotripsy, or ESWL, which uses shockwaves to break the stone into smaller pieces. Ureteroscopy involves inserting a thin scope into the ureter to remove the stone. Percutaneous nephrolithotomy, or PCNL, is used for very large stones and involves a small incision in the back to access the kidney. Preventing kidney stones involves several lifestyle modifications. Staying well hydrated by drinking plenty of water throughout the day is crucial. Dietary changes may include reducing sodium intake, limiting animal protein, and moderating oxalate, rich foods like spinach and nuts. Maintaining a healthy weight and managing underlying medical conditions are also important. In some cases, medications may be prescribed to prevent stone formation. The prognosis for kidney stones is generally good. Most stones can be successfully treated with minimal long-term complications. However, recurrence is common, so preventive measures are essential. Recent research is focusing on developing more effective and less invasive treatments for kidney stones. Nanotechnology is being explored for targeted drug delivery to dissolve stones. Personalized medicine approaches are also being investigated to tailor prevention strategies based on individual risk factors and genetic predispositions.